What if I told you that a tiny white patch in your mouth could be a bigger red flag than a blaring siren? Our bodies are constantly sending us signals, but the really dangerous ones, they're often silent. Today, we're going to decode some of these hidden messages and see why listening to them could literally save your life. It's our go-to move for so many things, right? Let's just wait and see if it goes away. But in medicine, waiting isn't just waiting. It's a gamble. And the cost of delaying a real diagnosis, it can be devastatingly high. And this is the biggest trap of all, what I call symptom whack-a-mole. You've got a problem, so you throw a cream at it. It pops up somewhere else, you throw a pill at it. Sure, you might feel better for a little while, but you're not solving the real problem, and you're just wasting precious time. The solution is simple. Stop guessing and get a real diagnosis. So let's dive right into our first medical mystery, the case of the deceptive white patch. This is something so many people might just brush off, but as you're about to see, ignoring it can have some really serious consequences. So, a white patch in your mouth, it's harmless, right? Wrong. Some of these things can hang around forever and quietly turn into cancer. And here's the paradox. The ones that look the most benign, the ones that don't even hurt, are often the most dangerous, precisely because they're so easy to ignore. Okay, this is so important. For any persistent white or red patch, especially in someone high risk like a smoker, the rule is simple and it is absolute. That lesion is guilty until proven innocent. A biopsy isn't just a good idea, it's completely non-negotiable. And this gets us to a super quick 30-second triage. It all boils down to one simple but incredibly powerful question that immediately tells us which path to take. Can you scrape it off? If the answer is yes, you can scrape it off, then our number one suspect is Candidiasis, or what most people call thrush. But here's the deal. Thrush is an opportunist. It only shows up when something else is off balance. So you can't just treat the fungus. You have to find the root cause, like uncontrolled diabetes, because fungi absolutely love high sugar. You got to fix the sugar first. But if the answer is no, and that patch is fixed, it's not going anywhere, that is a major, major red flag. This could be something called Leukoplakia or even worse. So here's the bottom line. If you see a white patch that doesn't scrape off and it's been there for more than 2 weeks, you demand a biopsy. Don't wait. Now, if you see someone who can barely open their mouth, like it feels like it's shrinking, that's another huge red flag. It could be something called oral submucous fibrosis, or OSMF. Basically, the inside of the mouth gets stiff from these fibrotic bands. It's often caused by chewing tobacco or areca nut. And it's not just uncomfortable. Up to 8% of these cases can turn into cancer. And get this, the only thing with level 1 evidence to stop it, quit. All right, next up, we've got a medical paradox that is way too common. It's a really painful condition where the usual treatment can actually make things worse. Let's talk about the anal fissure. So, a patient has an anal fissure. We're talking a sharp, searing pain. The common mistake is to just throw some topical anesthetic on it. Sure, it numbs the pain, but it does absolutely nothing for the real problem, an overly tight sphincter muscle that's basically choking off its own blood supply. The key is to break this vicious cycle. The tear causes pain, the pain makes the muscle spasm, and the spasm cuts off blood flow, which means the tear can't heal. So the solution, it's a topical calcium channel blocker, a special cream that tells the muscle to relax, lets the blood flow back in, and finally gives that tear a chance to heal. So let's just lock in on this term, sphincter hypertonia. It's the engine that drives this entire problem. The muscle is so tight that it's creating ischemia, a lack of blood flow. And without blood, there is no healing. It's really that simple. So let's compare the two approaches. The common error is just a cocktail of numbing creams. But the evidence-based first-line therapy is a topical calcium channel blocker like Diltiazem. For a chronic fissure that's been around for more than 8 weeks, this is the treatment that actually works and helps most people avoid surgery. Okay, for our final case, this is a story that's a stark reminder of why you can never, ever jump to conclusions when it comes to your health. Let's talk about the hemorrhoid alibi. This iceberg metaphor is just perfect. A patient comes in with bleeding, and you see hemorrhoids. It's an easy, obvious diagnosis. But here's the danger. Those visible hemorrhoids can be the perfect alibi for the real culprit hiding just below the surface, colorectal cancer. So you have to be on the lookout for this red flag combination. A patient over 50 with new onset rectal bleeding, especially if they're also losing weight without trying. These symptoms don't just whisper for attention. They scream for a full investigation, no matter what else you think you see. And this right here is the guiding principle you have to live by. For any patient with those red flags, it doesn't matter if you see hemorrhoids. They are clinically irrelevant until you have definitively ruled out cancer. The rule is simple: scope before you treat. Okay, let's wrap all this up with a final briefing. We're going to go over what we call never events in medicine. These are mistakes that are so critical, with stakes so high, that they should never, ever happen. Think of this as your non-negotiable checklist: delaying a biopsy for a persistent oral lesion, missing the red flags for rectal bleeding in an older patient. These aren't just simple mistakes. They are critical failures in patient safety, period. And here's one more critical event to add to that list. A patient shows up with severe swelling of their face and airway. The first thing you do is check their medication list. If they're on a blood pressure pill that ends in pril, that's an ACE inhibitor. You have to stop it immediately. It's another one of those silent signals that can be absolutely lethal if it's missed. So what's the one thread that connects all of these cases? It's a mindset. It's this simple understanding that curiosity isn't a luxury in medicine. It is a fundamental tool for saving lives. So from the mouth all the way down to the anal canal, the most powerful diagnostic tool isn't some fancy machine. It's a high index of suspicion. It's trusting those signals. So the next time your body sends you one, no matter how small it seems, don't just wait and see. Be curious. Ask questions. What is your body trying to tell you right now?